Each year, NUH has around 3,500 adult deaths. Approximately 300 of those will happen in a palliative care setting. The remaining can happen on any adult inpatient areas. These can be both expected and unexpected deaths. Care after death is a core aspect of nursing care that must be delivered with kindness, care and compassion. Ensuring that this is done correctly plays a huge part in the grieving process. The following video will help guide you through some important aspects of caring for the deceased. It is important to remember that care at the time of death is personal and must be individualised to each person's needs.
Hello, I am Sarah Radcliffe, Lead Nurse for Palliative and End-of-Life Care at NUH.
And I am Heather Davis, Deputy Nurse Bereavement Service Manager. We work at Nottingham University Hospital.
This video is aimed to help those who care for a patient around the time of their death. We recognise this aspect of care can be challenging, particularly if you are doing this for the first time. We hope this short video will help guide you. Care after death starts before the patient has died and ends when a patient has left the hospital. The moment the dying face has been recognised, there are a few things you need to consider. Wherever possible, offer a single room for the patient, but remember, not all patients prefer this. Who would the patient like to be with them? If loved ones are not present, how would they like to be contacted? Make sure the details of patient representatives are accurate and in the medical records. Are there any spiritual, cultural or religious needs to be honoured at this time? Ask what is most important to them at this time.
Confirming a patient has died should happen within 1 hour. This is to allow the body to be prepared for the mortuary. Lie the person flat on their back with the limbs placed by their side in a straight position. Leave one pillow behind the head. Clean the mouth with a soft toothbrush. If the patient usually wears dentures, make sure these are clean and return to the mouth as soon as possible. Close the mouth. You may need to support the mouth by using a towel rolled up underneath the chin. Do not use bandages to bind the jaw closed. Remove medical equipment such as any giving sets and medication or feeding pumps. Use pads and pants to absorb any leakage. Spigot any tubes such as catheters or feeding lines. Any wounds should be covered with a clean and appropriate dressing. Close the eyes by applying light pressure for 30 seconds. If eyes do not close, explain this to the loved ones in a sensitive manner. Do not use tape or gauze to cover the eyes. Wash the patient, if appropriate to do so. Remember, some faiths prohibit washing a body after death, so make sure this is discussed with those close to the patient. Do not shave a patient after death. This can cause bruising to the face, which appears later on. Remove any jewellery in the presence of a witness. Make sure it is returned to the patient representative in a jewellery pouch. These can be located within your SWAN resources. If jewellery is to remain with the patient, ensure it is taped lightly. Consider any personal or religious ornaments or belongings that are to remain with the patient. These include swan blankets, hearts and teddies.
Tidy hair in a preferred style as soon as possible after death. Leaving hair untidy for a prolonged period will cause difficulty styling later on. Dress the patient in clothing previously specified by the patient or those close to them. Alternatively, hospital issue gowns and shrouds can be used. Never send the patient to the mortuary undressed. Ensure the patient is wearing 2 mortuary wristbands, one on the wrist and one on the ankle. Place 2 sheets underneath the patient, leave the bottom sheet in place and use the top sheet to fully wrap over the patient. Lightly tape the sheet in place. Use a third top sheet to cover the patient. Do not use excessive amounts of tape or tape too tightly, as this can lead to bruising and disfigurement. If the patient has a contagious infection or excess bodily fluids are present, a body bag should be used. This should only be done when visitors have left. Call the patient movement team to collect and transfer the patient to the mortuary. This should be done ideally within 4 hours.
Some particular faiths require cremation or burial as soon as possible after death. To support this, when possible, ensure both the bereavement team and the medical examiner service are contacted and made aware before the patient has died. This will help the team prepare for urgent release of a death certificate. Ensure patient medical records are sent to the bereavement office at the earliest possible opportunity. This can be before the patient has left the ward or department, provided all documentation is complete. For full details on care after death and bereavement, please refer to the Trust bereavement policy.
Should I break bad news over the phone?
On occasions, a loved one may need to be informed of a death via the telephone. This should always be done in a sensitive manner. Information on breaking bad news over the telephone can be found on the palliative care website.
Do family members need to wait on the ward until death is confirmed?
No, family can leave the ward as soon as they feel able and ready to. Confirmation of death does not require them to be present.
Does every dying patient need handprints?
No, handprints are offered to family and friends on an individual basis. If they are offered, please ensure they are provided to loved ones before the patient leaves the ward.
Do all patients have to go to the mortuary?
Yes, a patient cannot leave the hospital premises until they have been to the mortuary.
What spiritual or religious needs do I need to take into account?
Spiritual needs are an important factor to consider around the time of a death. Ensure you discuss any spiritual beliefs or wishes with the patient or their representative.
Can the patient leave the ward before the family are informed of the death?
Yes, in rare and exceptional circumstances, the patients may need to leave the ward when a patient representative cannot be contacted. However, every effort should be made to inform them of the death before the patient is sent to the mortuary. A patient should not remain on the ward for more than 4 hours, ideally. After this time, the patient's body will begin to deteriorate. Family members should be advised to make an appointment with the bereavement office to visit their loved one.
What should I do with personal belongings?
Personal items should be returned to the patient's representatives as soon as possible. Any items of value should be recorded in a patient's property book and stored in the ward or department safe. If your area does not have a safe, please liaise with your neighbouring ward or department. During office hours, you can store valuable items in the Trust General Office. Each campus has a designated General Office. The location of these can be found in the Trust Personal Belongings Policy.
Here are some important things to remember. Always offer Swan resources and personalised care. Provide parking permits to loved ones who will be visiting frequently or for prolonged periods. Always give both verbal and written information to the bereaved. Using the Trust Bereavement Booklet, highlight the contact numbers provided on the front cover. Speak with kindness, care and compassion. Don't forget to inform other ward or department staff when a death has occurred, particularly those in front-facing positions, such as reception and clerical staff. Don't ignore the needs of neighbouring patients. It is likely that they will be aware of the death. Don't be afraid to ask for help from those staff around you.